All right, hello everyone. Today we're going to be going over CPR and how to use an AED. So CPR stands for cardiopulmonary resuscitation. CPR is an emergency procedure that is a combination of chest compressions and artificial ventilation, otherwise known as breaths, used to save a person's life when their heart stops beating or breathing ceases. By doing CPR, you can increase the chance of a person surviving cardiac arrest. The steps to CPR, what do you do first? You first want to check the area and make sure it's safe. If there's an unsafe area, you don't want to enter that because that could cause yourself getting harmed or other people getting harmed. However, if the area is safe, you want to go up to the person and see if they're conscious or unconscious. To do this, you can tap them on the shoulder and ask if they're okay, shout at them, see if they have any signs of life. If there's no response, begin CPR. And then after you begin CPR, if you're in a group of people, have somebody call 911. And then if there's another person, have them go get an AED if one's available. If it is you and one other person, that one other person can call 911 and go get an AED. And if it's just yourself, you can call 911 and put the phone next to the person on speaker and have the person telling you what to do as they're sending first responders to the scene. Also, if you're by yourself, never leave the individual to go get an AED. Just wait for the first responders to get there and do the chest compressions. And then you'll continue to do CPR until help arrives, the person starts moving or breathing, or you're too exhausted to continue, or an AED arrives. So going into compressions and breaths, you want to place the heel of the hand over the center of the person's chest. So this is considered the heel of your hand. And this will go right here on the center of the chest. You're going to place the one hand and then the other hand on top, like this. And then you want to keep your shoulders straight and above the hands. And then you use your upper body weight to push down to the chest about 2 inches. And you're going to be doing 100 compressions per minute. A cycle is 30 compressions, then 2 rescue breaths, and 5 cycles of CPR last about 2 minutes. If you have multiple people in your group, you can have one person do 5 cycles and the next person do 5 cycles. And if an AED is available, use it and follow the directions. You could have one person doing the AED, one person doing the breaths, and one person doing the compressions, and do it in a different cycle. Some more things to go with compressions and breaths. For the breaths, you will want to open the airway. To do this, you will tilt the person's head back and lift their chin up, and you want to listen and look. So look down the body and see if any movement is happening. If not, then you will begin chest compressions, and make sure when you're looking, you're not looking for more than 10 seconds because you'll want to start CPR as soon as possible if it's needed. And then to deliver the rescue breaths, you'll tilt the person's head back and lift the chin. So same as when you're looking, you lift the chin, and then you'll want to pinch the nose. So when you breathe in, the air doesn't go straight out the nose. And then you're going to breathe through here. I don't have a mask, so I'm not going to actually, but you're going to breathe a breath and see if the chest is rising. If the chest isn't rising, retilt the head because something may be in there. You might be choking. If you do see something, you can reach it out. Otherwise, continue compressions. And then if the chest doesn't rise and there is choking, you don't have to necessarily do the breaths, but the American Red Cross recommends it. You can just do compressions if you don't feel comfortable doing the breaths. And then you want to continue with cycles of compressions, 30 compressions with 2 rescue breaths, and you want to continue that cycle until the person exhibits signs of life, such as their breathing, the AED comes available, or EMS or trained professionals come to take over, or if the scene becomes unsafe or you're unable to perform CPR because you're too exhausted. If that happens, you don't want something to happen to you and then there's 2 people again that are harmed. And then CPR for an adult is a little different than CPR for an infant. So the same, you want to check if the scene is safe. For an infant, if there's a parent around, ask for their consent If there's not, assume they want you to do CPR. Same with an individual that's by themselves, such as an adult. You want to assume they want help. You can't be sued for not trying to help them. And then for a child, you'll still tap the shoulder and check for breathing. For an infant, you'll tap the bottom of their foot and see if they're breathing. And then you'll still call 911 and begin CPR. For a child, it's the same as an adult, so you do 30 compressions. However, if it's a smaller child and you feel comfortable, you can do one-hand compressions instead of the two. And then for an infant, you'll do 2 fingers placed parallel on the chest, and you'll push down 1.5 inches at 100 compressions per minute. And then you'll continue to do the 30 compressions, 2 breaths all the way through. And then what is an AED? So an AED is an automatic external defibrillator, and what does it do? It sends an electric shock to the victim's heart. It tracks the person's heart rhythm and can restore the heart rhythm. And then an AED gives visual and auto prompts with what to do. So the AED will actually have pictures on it that show where to place the pads, and it will tell you exactly what to do when the shock advised, when to start CPR. And yeah, the AED tells you when to do CPR again. When the AED becomes available, you'll turn it on, and then you'll want to remove the clothing from the victim and attach the pads correctly. You'll just have to remove the clothing covering the chest. If the person is sweaty from a run or swimming and their chest is wet from sweat or the water, you'll want to try to wipe that off with something so the chest is dry and the pads stick to it. If it's a man who has like a hairy chest, sometimes an AED will have a razor in there. Otherwise, the pads are sticky, so you can place them on and rip them off, and then they have new pads in there you can replace it with. And then you'll want to place the one pad on the upper right side of the chest. So it'll go down here, and then the other pad will go here below the left armpit. And then you don't want the pads to be touching each other. So for an infant or a child or a smaller individual, if they're touching each other, you'll want to place one on the middle of the chest and then one on the back between the shoulder blades. And then when you do that, you want to prepare the AED, and it'll analyze the heart's rhythm. Make sure when the AED is doing that, no one is touching the person, and when the shock advised, make sure no one is near the person or touching the person because you don't want them to get shocked. And then after the shock is advised, the AED will tell you to begin chest compressions again, and you can do that. I have an AED with me. So they usually, a lot of schools, businesses, other places have these available. If not, just continue with compressions until someone gets here. So it's just a little thing that looks like this. And then the pads are here. Sometimes they have smaller sizes for individual, like children, infants. Otherwise, like I said, you put one on the back and one on the front. And then it will show you the different pictures. So this one goes right up here, and you'll want to peel this off so it sticks. And then the other one goes right below the left side of the chest. And then when it's turned on, it will go through it and speak to you, and it will tell you when to, the shock. When it does the shock, don't touch it, and then you can continue doing the chest compressions after it tells you to. And then the 2 breaths. So we just have a short video here that will show you how to do it, and then I will have you guys come up and practice doing a simple
One suddenly collapses and doesn't respond when you touch or speak to them. If they aren't breathing or are making strange gasping sounds, they might be having a cardiac arrest. With 3 simple steps, you could help save a life. Don't hesitate. Every second counts. First, call 911 or ask someone to call for you. If there are people around, shout for someone to bring you a defibrillator AED. Next, start CPR immediately. You can do this. Put one hand on top of your other hand and push hard and fast in the center of the chest. Push about 100 to 120 times per minute to the beat of Staying Alive. Keep your elbows locked and push hard. Keep going until someone else takes over. If someone brings you an AED, use it as soon as possible. It's easy. Turn it on and follow the voice prompts. Don't worry, the AED will tell you what to do and won't hurt you or the person. The 911 dispatcher can coach you through all of the steps. You can save someone's life using your phone, your hands, and an AED. Don't hesitate. You can't hurt. You can only help. heartandstroke.ca/CPR.
Alright, so if one of you wants to come up and practice going through the whole thing, one of you can be the bystander who is there, who can call, and the other one just walk through the steps.
Am I using the AED or am I just doing a compression?
You can just do the compressions for
Okay.
now. But go through the whole thing. You find the victim laying there.
Yeah.
What's the first thing you're gonna do?
Call 911. But I have a bystander here, so Hannah, can you call 911
Sure
please?
thing.
Awesome. So then I'm going to want to tilt the head back and look down to see if the individual is breathing or not. And also here, right? And then hand position. Over the hand. Just staying alive.
Yep, and you're gonna be doing 30
So
compressions
30. Oh, God.
and 2 breaths, but you don't actually have to put your mouth on the mannequin.
Okay, I do the 2 breaths first.
No, compressions first.
Compressions first. That's right. Alright, go.
Help's on their way.
Thank you. Alright, so then pinch the nose, lean it back, so breathe and breathe.
Yep, make sure the chest is rising.
Right.
And then continue with the compressions.
Right. You want me to continue or
Yep.
just okay?
Go through 5 cycles.
Oh,
So this is your second.
beautiful.
And if an AED arrived, then you could put that on there, but you'd still be doing
Oh, look,
compressions.
I found an AED.
Thank you.
Let's get it set up for you. Here.
Still do compression.
Yep, since she's still
Okay, I
silent.
turned it on.
Okay.
It says stop.
Okay.
Yep, so stay clear. Make sure they know.
Yep.
And then
Shock of eyes.
you can
Okay.
continue compressions after the shock.
Shock of eyes.
Yeah.
Okay. Beep. Okay. Boop. Shocked them.
Okay, on the 4th.
Yeah. I think so.
Shock him again or no?
Oh, keep going.
Okay.
We'll see if it
And,
calls for one.
Okay.
The first responders are almost here and they're gonna take over.
Yep.
Can't wait.
Oh, it's beeping at us.
Okay.
Shock of eyes. Okay. Clear. Beep.
Alright.
Okay.
We're good.
Yep.
Yep.
And the first responders
Oh.
are here.
Get out of the
So,
way.
so that's an example of kind of what you do. The AED would be talking to you normally and telling you exactly what to do. But yeah, keep the compressions. The only thing is when you first get there, make sure the scene is safe and ask if the individual's okay.
Oh, yeah.
But other than that, it was good. So yeah, that's a little overview on CPR and how to use an AED. So thank you.